This video is going to be looking at the cognitive treatments for depression. And there's two you need to know on your specification: Beck's cognitive therapy and Ellis's REBT, or rational emotional behavioral therapy. So first of all, we're going to look at the AO1, the theory and the models for Beck's cognitive behavioral therapy and Ellis's REBT. So both of Beck's and Ellis's treatments are forms of CBT, or cognitive behavioral therapy, and they both focus on challenging irrational thoughts that interfere with someone's happiness and result in depression. And CBT is by far the most common psychological treatment that's used to treat depression. And both treatments work in a similar way. The first thing that will happen will be an assessment. We need to clarify the problem, so the therapist and the patient will sit down and clarify what the issue is. Then it's about identifying goals. It's about the therapist and the patient being able to plan for what they want to achieve. What irrational thoughts do we need to try and change? And finally, they work towards changing them. In their therapy sessions, they will try and get more effective behaviors, more rational thoughts in place to hopefully cure someone from depression. So the first one we're going to look at is Beck's cognitive therapy. And the first thing they'll try and do is identify that negative triad, that the world, the self, the future, the negative views that someone has in those three particular areas. And this can be called thought catching. The therapist will try and catch the thoughts of someone. What are their negative views of the world? What are their negative views of their self? What are their negative views of the future? And they will try and challenge those thoughts. The therapist will challenge the person on their views of the world, the self, and the future. And they'll try and help the patient to realize the reality of their thoughts, that their thoughts are irrational. And what they'll do is they'll try and make the patient become the scientist, or to become the therapist. And they do this by setting homeworks. So, for example, they might ask the person to record every single time that someone makes a nice comment for you. Keep a diary. Every time someone makes a nice comment, write it down. And then they bring that to the session, and the therapist can use that as evidence that, right, not everybody in the world hates you, because you wrote here on Monday that your sister said how nice it was that you helped her out and that she loves you for that. So you've got this evidence building up, and you use that evidence to help challenge all the irrational thoughts that a negative and depressed person would have. And that is how the process of Beck's cognitive therapy would go. You identify the negative triad, you challenge their irrational thoughts, and you use evidence that they get from their homework sessions. So if you're ever putting an answer in your exam, you'd have to mention those things: identifying the negative triad and setting homework that you can use for evidence in future sessions to challenge someone's irrational beliefs. So the second type of treatment we're going to look at is Ellis's treatment. And this is REBT, this rational emotional behavioral therapy. And that's more of an umbrella term. REBT is an umbrella term for what Ellis created. And Ellis created, remember, his model of ABC, the activating event, the belief, the consequence. And his treatment builds on that. It goes from ABC to DEF. And DEF is the treatment, the way we try and treat someone who has depression. D stands for disrupting it. E is the effect. F are the feelings that occur as a result of the treatment. So just to break down what DEF actually mean and what the stages actually involved. The disrupting stage will all be about challenging someone's irrational beliefs. It will be using evidence, it will be arguing with the person, and in REBT it involves a lot of vigorous argument that we'll go on to talk about in a little bit more. And once you've disrupted their irrational beliefs, it should result in an effect. And that effect is to reduce their levels of depression, give them more rational thoughts. Finally, that results in them being more positive. And that's the feeling, the F part. So we've got D, disrupting, E, the effect, F, new, more positive feelings. One of the key aspects of Ellis's REBT and this ABC to DEF treatment is vigorous arguments. And this is where the therapist will aggressively question the rationale of someone's beliefs. So they force the actual patient into questioning and seeing how unreasonable their beliefs are. And they do this in a number of different ways. Firstly, they'll ask them, how logical is it? Do your thoughts actually make any sense whatsoever? They'll then ask them, right, what evidence do you have for this? What evidence do you have that everybody in the world hates you? And finally, they'll ask them about, is their belief pragmatic? Is it useful in their life? Does it interfere in any ways with their day-to-day life? And this aggressive form of questioning and interviewing will hopefully result in them understanding that their beliefs are irrational. And if they believe their beliefs are irrational, then we can start to change them and cure someone from depression. Ellis's REBT is similar to Beck's in the way that they both use homework. So in REBT, the therapist might ask the patient to do a number of tasks. They might go, right, what you're going to do this week is you're going to go and ask someone out on a date and see what they say. What do they say? Just write it down. Write down their response. Write down how they've responded to you. They might ask them to ask all of their friends about what they actually think about them. And again, record that information, bring it to the next session. And what we're hoping here is that we're putting their irrational thoughts to the test in reality. We're getting what they think, everybody hates me, and then getting them to record down what their friends really think. And hopefully we start to build up a bank of positive experiences, of positive thoughts that we can then share as a therapist with the patient in their next session. And with all this evidence, we should hopefully be able to change their irrational beliefs to something more rational. So again, in any answer that we're talking about Ellis's treatment, there's two things we've got to mention. We've got to mention the ABC to DEF, how we change the disruption, the effect, the feelings, and also this vigorous debate. Is it logical? Do you have empirical evidence to support it? Is it pragmatic in your life? Three things that the therapist will aggressively question in order to challenge someone's beliefs. When we're looking at the evaluation points, the AO3 points, because the treatments are both cognitive and they're both looking at changing irrational thoughts, the evaluation points can be the same for both. So whether you choose to talk about both therapies in your essay or you just talk about one, you can use the same evaluation points for both types of treatment. There are studies that show that CBT is an effective form of treatment for depression. So March in 2007 had three groups of people, and I've put the percentage of people who improved in brackets. So if we look at CBT, 81% of people in that group managed to improve their symptoms of depression. Antidepressants, the exact same. So it shows that CBT can be as effective as antidepressants. But the third group had both of these combined. They used CBT and they also used antidepressants. And they were found to have the highest success rate. So maybe that's the best way to go. CBT is as effective as drugs potentially. However, a combination might be even more effective. One of the main advantages of CBT over drugs is that it focuses on the cause. So whereas drugs only really treat the symptoms and make you feel slightly better, they don't deal with the actual underlying issues. And that is one of the major advantages of psychological therapies, such as CBT. They focus on the underlying problems. If we can get rid of the underlying problems, then it can have long-term effects. It won't come back. If someone starts taking antidepressants, for example, the drug, then they stop taking them, the symptoms and depression is going to come back. Whereas with psychological therapies like CBT, if we can get to the underlying root of the problem, those irrational beliefs, and if we can change those irrational beliefs, then there's going to be long-lasting benefits for the person involved. However, like all psychological therapies, there are disadvantages to CBT. It is very time-consuming. It can take many sessions a week that last a number of hours over many, many years. So it can be a very time-consuming process. In addition, sessions can last easily £100, £200 a go. So it can be a very, very expensive way of treating depression, and not everybody can afford that. In addition, some people suggest that only people with a high IQ can actually take part in this type of treatment. You've got to be able to access your beliefs, acknowledge that they're irrational, change your irrational beliefs, be involved in vigorous arguments with a therapist. And some people believe that only people with a high level of IQ can actually take part in this. So it might be that this is only for a small percentage of the population, and that it's not readily available and readily accessible to the rest of the population. In addition, certain people don't like to open up to a therapist. One-to-one, they just don't want to do it. They don't want to release their innermost fears or give up their beliefs and their irrational beliefs. Remember, they might be aware that they are irrational. Some people don't like opening up to a therapist. So sometimes drugs can be an easier alternative in that situation. And also, severely depressed people, remember, lack energy. So if you're lacking energy, you've got to therefore lack the ability to get out of bed. You're going to lack the effort to get to a therapy session. You're going to lack the effort to get involved in the session as well. So sometimes people who are going to be involved in CBT sessions will also need drugs in the first place. They might need drugs in order to increase their serotonin levels, in order to get more energy, in order to feel better. So sometimes depressed people are actually unable to have the motivation and lack the motivation to get involved in the sessions. Another limitation of CBT is that it ignores the past. It only really focuses on the future, on the present, on the irrational beliefs that a person has and how we change those irrational beliefs. However, childhood does have a major impact on your life, and sometimes a person's depression might be linked to childhood experiences. But these CBT sessions ignore that. It's all about changing irrational beliefs and gathering evidence about what's happening at the moment. And it ignores this role of childhood. And sometimes if we explore that option, and sometimes if people really want to do that, then that might be a better solution. And a major limitation of this treatment is that it does ignore the past. It ignores childhood and only focuses on the future and on the present and on someone's irrational beliefs. Some critics have also stated that it has an overemphasis on cognition, that cognition can't be the only cause of CBT, and that these treatments ignore everything else. For example, if someone was homeless or was suffering abuse at home, then that's clearly a reason why they might become depressed. Whereas these treatments don't really take those things into consideration. And these need to be dealt with before we can really start to challenge someone's irrational beliefs. And this is one of the major limitations of CBT, the fact that it only focuses on the beliefs and changing someone's cognition. If we have a quick recap then on the sort of things you'd want to be talking about if it asks you to evaluate cognitive therapies. There is evidence out there. Okay, we looked at March's study and that it can be as effective as antidepressants. However, there are an awful lot of limitations to therapies. It is expensive. It can be time consuming. It can maybe only be accessible to those with a high IQ. It focuses on the cause, so it gives us a long-term benefit. Okay, therapy is better than drugs in that sense. It can be a long-term benefit rather than just treating the symptoms. However, it does ignore the past and it only focuses on cognition. It ignores other things going on in people's lives that might be a major cause of depression.